Okay.
Bailey, this is a test. Can you hear me?
Yeah, I can hear you.
Yeah, but we moved like
We can hear you.
5.5 years ago.
Okay, Sam, this is Bailey. Can you hear me?
But yeah.
I used to walk
Yeah,
my
we can
dog
hear
a
you.
lot on Branch.
Yes, that's
So
true.
you were
I
probably
recognized
driving
you.
down.
Yeah.
All right, it's 4:30, so I will call the meeting to order. We'll start tonight with roll call. Just answer here if you're present in the room, and answer on Zoom if you're on Zoom. Thomas Fetchin.
Here.
Jessica Smith.
On Zoom.
Amy Crow-Sunleaf.
Here.
Sandra Larson, here. Adam Hoffman. Marsha Horowitz.
Here.
Hendrik Schultz. Okay, so Hendrik Schultz and Adam Hoffman said that they may be able to get on a little bit later. Adam was flying and Dr. Schultz has a meeting, so. But we do have a quorum here in the room, and then with Jessica on Zoom, we have another member, so that's good. We'll have public comments now. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand on Zoom or raise your hand here in the room. When you're called upon, please state your name and home address. Individual remarks will be limited to 3 minutes. Is there anyone in the room that would like to make a comment about something that is on our agenda tonight? Seeing none, is there anyone on Zoom?
Carla did, but she went to the restroom.
Okay. Is there anyone on Zoom that wants to make a comment? I see some hands raised. Will you call on those, Bailey? Will you take care of that?
Wayne Kennecker.
Yes, thank you. Can you hear me?
Yes.
Wayne Kennecker, 11645 Lizer Lane. Just a quick question about the change in time for the meetings. Most of the public meetings, whether it's a school board, emergency management, 911.
Mr. Kennecker, I
Yes,
don't believe the issue of the time of the meetings is on the agenda tonight.
I was assuming that the time was in a part of the agenda. So I can speak at the end of the meeting. That's fine if that's
I
what
think
you would
that would
rather.
be better, Mr. Kennecker. It was on the agenda last month, but it's not on the agenda this month. So I appreciate your patience. Thank you.
Thank you.
Diane.
Diane Pay Freiberger.
My name is Diane Pate Freiberger, and thank you for allowing me to speak. I am.
Your address, please.
I
Your street
live
address.
in 17145 Middle Road, Dubuque, Iowa. Thank you.
Thank you.
I was made aware that the healthcare providers have received a letter within the last day regarding vaccinations. And the letter came from the federal government Health Resources and Services Administration. And in that, they were told that on April 5th, 2022 at midnight, the Coverage Assistance Fund will stop accepting vaccination claims due to a lack of sufficient funds. And I know that this is something that we've been watching in the news, and I was concerned that this may be the direction that the federal government may be going. And I would like for the Board of Health and the staff and the incident management team to make sure to keep this in the forefront as far as funding for those that may not have insurance. I assume that they're going to encourage insurances to go ahead and cover those. But from the very start of the pandemic, with testing and with vaccinations, that has been a concern, that those that do not have insurance may not have the resources, because now they're talking about a second booster, or if somebody wants to even get started in their vaccination process, it will not be covered. So please make sure to keep this in front of you. And I will be writing our US senators and representatives to encourage them to to again add some more funding for this. Thank you.
Thank you. Is there anyone else on Zoom that wishes to make a comment about something that's on the agenda? I don't see any hands right now. Is there anyone in the room that would like to make a comment about a topic that is on the agenda? Thank you. Seeing none, we will go next to chairperson announcements and updates. What I would like to call everyone's attention to is the Iowa Public Health Association. I recently joined, and it's a very good organization. I believe Bailey and Samantha are also members, but anyone that's on this board could join. On the third Thursday of every month, they have a lunch and learn on Zoom. And the last one that I attended was about workforce development in public health, and it was very topical for what we're dealing with now with the Board of Health, and very, very informative as far as what's happening in the other counties in our state. I would urge you to go to their website and see what you think of the group. It is Iowa PHA at wildapricot.org. Sure. And then if anyone is interested in joining, I think, I don't know that we have it in the budget, but we could maybe do some investigation to see whether the Board of Health could actually cover some of the costs for that. The second thing I'd like to bring up, there are several groups in our county that are meeting on a regular basis that I think it would be a good idea to have the Board of Health make an appearance at some of their meetings, or at all their meetings. And so I'm just going to mention these three organizations, and if someone on the board, if anyone is interested in these commissions and coalitions, let me know. And then if you would commit to attending each one of their meetings, most of them have the Zoom option, so you wouldn't have to actually be present. But the three organizations that appear to be, that I've noticed that could use our presence are, first of all, the Dubuque Area Substance Abuse Coalition, and they go by the acronym DASAC, and they meet, I believe, once a month. The second group is the Dubuque County Food Policy Council. And again, I believe they meet once a month. They're dealing with their strategic plan right now. So if someone would be interested in observing their process, it will help when we come to our process. And then the third group is the Dubuque County Wellness Coalition. And that group actually, Samantha from the Department of Health runs those meetings. So it would be just would be a good presence, I think. So you can volunteer now, or you can let me know after the meeting if anyone's interested.
I actually zoomed into the Wellness Coalition.
Okay, all right.
this past week.
Is that something you would like to commit to attending for a while?
Sure, it's a
Okay.
once a month meeting.
All right, great. Thank you, Marsha. And anybody else?
I'll do DASAC. I went to their first meeting,
Great.
reorganized meeting.
Thank
And
you,
I'm
Amy.
sorry, my watch keeps pinging.
Sorry.
Tell me how to turn it off. Somebody else who has an Apple Watch, and I will. That's how I do it. I think I might have done it.
Oh, thank you very much. And so then, you know, once a month after their meeting, at our meeting, you could report back if there's something of interest to the board, something that we should know about or get involved with. The last one is the Dubuque County Food Policy Council. And if anyone is interested in that, let me know. And then we'll go from there. I appreciate that.
Isn't Samantha involved with that as well?
I believe she attends that meeting, yes, yes. So
Yeah, I do.
the Department of Health has a presence there. I'm just looking for the Board of Health to have some visibility, so. The next thing on our agenda are comments from our liaison from the Board of Supervisors, Supervisor McDonough. Do you have any comments?
I do, thank you, and I will attempt to be brief. The first relates to something that's actually on your agenda today, and that is the variance requests for the septic system and also permit changes under item 9. I just want to make 2 comments about how county can assist. Of course, we have county attorney resources if you're stuck. If you're in a spot and you need advice and there's difficult cases, I think you can use the county attorney's office as a resource. They should be providing support to our councils and our boards. So I don't know if anyone is actually here right now from the county attorney's office, but that would be, I think, something I just want you to know that that's a resource you can ask. Sandra, I think you indicated in Johnson County, a member of the county attorney's office actually attends the Board of Health meeting. So as we move into what you wish to be, just think about that as being a resource you might want to take more advantage of. Also, with ordinance changes comes the Office of the Auditor. And Kevin Dragato is the Dubuque County Auditor. I believe he might be on Zoom with us tonight as well. So when you are talking about those things, you will be coordinating ordinances and even comment on your permit process or something. Again, the auditor is a fantastic resource, and you may not necessarily know about that office, but they do the coordination for the ordinances as well. So they're a resource. And I know Samantha and Kevin Dragato have been meeting. The 2 reports that we've asked for input from the Board of Health. As supervisors, we've asked you to review the VNA request for enhanced 5 additional persons to be included in their expanded program of payee services. And they wish to do more education. That would be nutrition. There's just a lot of things in there that maybe we just wanted to say to the Board of Health. If you have comments, we'd appreciate it. And then also the Mercy One mobile unit is up and out. And I think this might relate to what Diane was just mentioning about if we're going to need to be doing vaccinations differently or more enhanced. You folks probably know better the mobile one unit and maybe can give us some input about, if you value those things, it matters to the supervisors to hear that. You can either give that information today. You certainly can reach out to the supervisors directly. But that conversation would be helpful to us to see if these are also, if they fit inside priorities that you share. So thank you. Looking forward to the meeting this afternoon.
Thank you. Thomas. All right, the next item on the agenda is the approval of the agenda. Is there a motion to approve the agenda, or are there any changes?
This is Hendrik. I make a motion to approve.
Thank you. Is there a second?
I'll second.
Thank you. Is there any discussion concerning this?
I guess I do have some discussion. We've been asked to weigh in on, as County Supervisor McDonough just mentioned, we've been asked to weigh in on the Mercy One mobile unit and the VNA request.
Yes.
They are not on the agenda. Can we deliberate those tonight or not?
I believe that we can if we amend the agenda.
Okay.
I believe so.
So
Is Mr. Dragato on the?
Kevin was on. I saw his.
Yes. What can I help with?
Kevin, if we amend the agenda now, can we deliberate on something that wasn't on our printed agenda?
we don't amend our agendas for the Board of Supervisors. That's not unfortunately, a question that I think I can readily answer on the fly.
Okay. Well, then, thank you. Then I don't think that we can deliberate to that
Can I,
tonight.
so,
Go ahead.
Sandra, I think though that you can have under even your new business, you can add that item as new business. You just can't take formal action, but certainly, your comments can be, I think there can be discussion under new business. That's what this is.
I would concur with that as well.
Okay, as long as we don't make a decision, we could discuss it.
As long as we don't take any formal action.
Action, okay. Would someone like to make a motion to amend our agenda?
This is Hendrik. I make a motion to
This
amend
is
the
Jessica.
agenda.
Okay. Dr. Schultz, you're making a motion to amend the agenda to add the 2 ARPA requests. Correct? He's frozen. He's shaking his head. Okay, so the motion on the table is, should we amend the agenda to add the 2 ARPA proposals that we were given this afternoon to discuss those? Is there a second to that motion?
I'll second the motion.
There's been a second. So we'll now take, is there any more discussion about whether we want to amend? Hearing none, then let's take a vote. All those in favor of amending the agenda, please state aye. Aye.
Aye.
Those opposing amending the agenda, please say nay. Hearing none, the motion passes. So the agenda is amended to add those 2 items under new business, number 10. And we'll add it as B, ARPA proposals. All right. Moving along then, the next item on the agenda, before we move on, I'm sorry, I did not take a roll call of those people who are in our room. So if we could just go around the room and if you could state your name and your home address, please. We'll start with you, please. Yes.
Carla Castle, 1220 Rush Street in Dubuque.
Thank you.
Deb Anglin, 280 Bryant Street, Dubuque.
Thank you.
Kenneth Beasing and Associates, 1212 Locust Street.
Thank you.
Kathy Wymasker, 6559 Weber Road.
Thank you.
Elizabeth Kelsey with the Telegraph Herald. My address is 3090 Spring Valley Road.
Thank you very much. Thank you. Getting back then to the agenda, we have the approval of the minutes from February 16th, 2022. Is there a motion to approve those minutes?
I move to approve.
Thank you. Is there a second? Is there a second to the motion to approve the minutes from February 16th, 2022?
I'll second.
I'll second. Yeah.
We got it. Thank you. Is there any discussion about the minutes?
I had a question.
Okay.
There were 2 terms that I didn't, 2 abbreviations, DEI and doula program. Let's see.
The doula should have been with the visiting nurses, I think.
Yeah, both were with the visiting nurses.
The doula is the birth. It's like a birth assistant for the
Okay.
mother.
Okay.
And then, let's see, where was the other one at?
What does that refer to?
Oh, right there.
Yeah, right. What is that?
What was
Where
that?
is that?
Diversity, equity, and inclusion. I believe.
Okay, okay.
Right.
Thank you
Yeah,
very
that's
much.
right.
Thank you.
Yeah,
All
that's right, Amy.
Okay, thank you.
Thank you.
Having that discussion, is there any further discussion on the minutes? Hearing none, then let's take a vote. All those in favor of approving the minutes from the last meeting, please say aye.
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 Those opposed, say nay. The motion passes. The minutes are approved. The next item, number 7, response to public comment and questions since our previous meeting. And Samantha, would you like to take that?
Yes, I will share my screen here.
Thank you.
Okay, is everyone able to see that?
Yes.
Yes.
Okay, good. Yeah, so we only had one comment made to the Board of Health since our last meeting, and that was an emailed comment sent on March 1st to the board as a whole. And in that email, they were asking for updates on some ARPA proposals from the Dubuque County Behavioral Health and Judicial Advocacy Support Services Program, and then also the Food Policy Council's proposal. And then they were asking the cost per vaccine per person in Dubuque County. And then I just made a note down at the bottom that there was email correspondence between me and the individual on March 2nd and March 16th, where I provided them with updated versions of those two proposals and let them know where the Board of Health and Board of Supervisors stood on those right now. And then for the cost question, I let them know that the COVID vaccine is free to everyone, and that individuals cannot be billed for that vaccine or should not be billed for that, and sent them some online resources with more detailed information about why that is and who does get billed for those things. So then I just left it up to the Board of Health if there's any other comments or questions related to this public response.
Thank you, Samantha. Bailey, can you move the pictures on the?
Just minimize that.
Yeah, yeah.
Yeah, right there.
So can everybody see the questions? They wanted to know what was happening with the Dubuque County Behavioral Health and Judicial Advocacy Support Services proposal. And I know, Amy, you've been involved in that. Have you heard anything recently? No.
I was kind of wondering what the status was on
Right.
this one.
We know that it's been, we passed it to go to the supervisors. We did not make it part of our budget back in December, but we did pass it, I think, in September. And so it is one of the proposals before the supervisors. And then the second question was, is Michaela Freiberger Food Council proposal still in the works? And as far as I know, that's also sitting before the supervisors for decision along with all the rest of them. And then the cost per vaccine, Samantha gave that answer. And of course, we heard tonight from Diane Pate Freiberger that that may be changing in the near future. So, all right, very good. Thank you, Samantha. Are there any other comments about those questions or any? Hearing none, then we will go on.
Sandra?
Yes.
Sorry, I just want to let the board know that Jess Smith did message me and she had to hop off this meeting, but we still have a quorum in person and Hendrik on Zoom.
Okay, thank you. Do you know if we expect her back or?
I do not think so, no.
Okay.
Sorry about that.
And sorry to interrupt. This is Adam, and I'm here now.
Okay, thank you, Adam. That was Adam Hoffman, one of the vice chair that has just checked in. The next item is number 7B, guest presentation from the Iowa DNR. Samantha, would you want to, or Bailey, do you want to introduce the people who will be speaking?
Yes, Corey Frank with the Iowa DNR and Eric Wickland, also with the Iowa DNR.
Okay.
How are you guys doing today? This is Corey.
Hi,
Can
Corey.
Hi.
We can hear you and you're looking good, so.
Well, thanks for that. That's always thanks for the compliment. Yes, Eric Wickland is with me today, my supervisor, and I'll let Eric introduce himself, but I'll introduce myself briefly because I want to get on task with what the agenda is today. Like I said, my name is Corey Frank. I'm with the Iowa DNR. I am the coordinator of the on-site wastewater program or the private septic system program, which that consists of a lot of different things, which I'll be talking today a little bit to the board health about those things, what we do and in our expectations for our counties when it comes to those programs. My background, just so you know, I spent 15 years, 16 years as a county environmental health person or a sanitarian, just like Bailey in the county. So I have a pretty deep county background, dealing, spent a lot of nights, minutes, time in county board of health meetings. So that's also part of my background. And I did spend about 4 years with the Iowa Department of Public Health, where I was in the office of local board of health technical assistant. So I do have a little bit of knowledge when it comes to powers and duties and things like that. And I'll talk a little bit today, but I do want to thank you for allowing me to and Eric to come today and talk to you about the things that we've got going on and our expectations and go from there. And I really appreciate the opportunity to do that. So I'll let Eric, if he wants to introduce himself, go ahead.
Sure. Thanks, Corey. I'm Eric Wickland. I'm the NPDES Program Supervisor, which is National Pollutant Discharge Elimination System. Supervise the 5 programs that fall underneath there, which includes the on-site wastewater program. So just here to back Corey up today. Thanks for giving us the time to speak today.
Okay. So I do have a PowerPoint. I know we've got some limited on time. And like I said, I've spent a lot of time and years in board of health meetings. So I know how valuable everybody's time is. And you're doing this as volunteers to do the good of the county. So I want to try and, I'm going to limit to what I think the highlights are, just so you have a little bit of background. And if it's something that you want me to skip through, just let me know and you can interrupt me. This is informal. I'm used to dealing with septic contractors. So I know that my audience today maybe sometimes will more behave than they are sometimes. So don't be offended by interrupting me. Keep going there. So I'm going to try and share and we'll see how this goes. Sometimes that works really well. Okay. Sometimes it works really well for me and sometimes it doesn't. We'll see how this goes. So hold on a second. Okay. So you have to tell me what you see when you see it.
We see it. Yeah. Iowa Department of Natural Resources.
So you're seeing the full slide then, I take it?
Yes. Yes.
Great.
Oh, we're seeing the editable version of it. So we're not seeing the presented, but if you zoom in on a little bit, it's probably okay, Corey.
How was that? Is that better?
We're still seeing the original screen. We're not seeing the presentation mode, if that's what you're shooting for.
It's not good.
It'll work.
You can click through these slides.
Yeah. Well, you don't see one slide, you see presentation mode, then I take it, huh?
Well, we just see basically the PowerPoint open on your desk with the slides on the left or on the left, and then the center one, like the edit mode.
Yeah. I don't know why it's doing that because I didn't have that earlier. Now it's locked up. Now you see a big screen. Hold on here. Now you probably don't see anything, right? Or you see
your Word documents.
Okay. Just a second here. Let me get back in here. Apologize. Thought I had it all worked out here. So while I'm doing that, there it is. Okay. I think I know what the problem is here. Just a second. Let me stop sharing. I'm going to reshare here.
If you're getting the presenter, if you're getting the presenter screen in, there you go. Now under the 3 little dots on the main one.
Yeah.
Click on that and then you should be able to turn off notes mode or something like that. Hide, right down, it says hide. Yeah, click that and then we should just get the full screen.
Is that what you're getting?
Screen. Nope, now we're getting just your desktop.
Oh, man. Okay, here, let me do this again.
Maybe I'll stop trying to help.
Hey, no,
I
that's
just did this
okay.
This week and I didn't have any troubles on Zoom, so.
And I didn't either, so it is, we'll see what happens. So let me try this again.
This works.
It'll
Yeah, that
work.
works.
It'll
Yeah,
work.
just stick with that, Corey.
Yeah, it'll
Okay.
work.
All right, sorry about that, but.
No problem.
All right, so once again, with Iowa DNR, I'm here to help most of the time, except for today. We seem we're having some problems here. So for some reason now, okay.
There you go.
All right, so I'm clicking through. All right, so I already know who I am. So let's talk a little bit about legal authority. And I don't want to bore everybody. And most, I think, as Board of Health members, you probably have had this and yell at me or say, tell me if you've had already kind of an overview of what gives you the legal authority to do what you do. Have you had that kind of presentation in the past?
A review of that would be, a brief review would be good, I think.
Okay, good. Well, we'll start with that. So I'm going to talk a little bit about Iowa code versus Iowa administrative code. That's really, a lot of times people, and especially the general public, have a tendency of confusing the two, and what one is and what the other is a result of. So, Iowa code obviously is passed by the legislature in that big building with a dome on it. It's sometimes frequently amended, lots of action. We're in the middle of the legislative session right now, as you are all aware. This is the second funnel week, and if you've never been engaged in the legislative process, it is fascinating, and every state has a different process. In Iowa, we have what's called funnels, and we're in the second funnel. So that's where these bills, such as these files, that are created by either the Senate or the House, they're given a House file or a Senate file number, or they're a study bill, or there's different types of bills. I always go back to the days of Schoolhouse Rock. It's really has helped me over the years. I'm only a bill, but so they're numbered. So Iowa code, when they pass these laws, and they are really laws, they then require administrative code, administrative rule to implement those things. And the ones that we're going to talk today about is IAC, Iowa Administrative Code 567, and primarily Chapter 69, 68, and 93 a little bit. When we do this administrative code, and Eric can attest to this, I mean, it has become more of a lengthy process for us to do rulemaking. And I've got another slide that shows it. It used to be probably a room full of people and things were done internally. And then things went to the ARRC, Administrative Rule Writing Committee, basically for approval. That committee does that, and then it went into effect. Well, now there's about 113 step process that we use to go through trying to develop an administrative rules. So, and then do amendments and updates. So, like I said, it can be a lengthy process, but necessary. So Iowa code, like I said, defines the local Board of Health powers and duties, gives you jurisdiction, what your jurisdictions are, what your powers of. Here are the kind of the highlights of those. So, it requires that you enforce state health laws. It also requires that you employ persons as needed to perform those duties. It specifically talks about in 137, providing environmental health services as needed to protect public health. This is where it gives you the authority to issue permits, licenses, charge fees for solid waste, private water, sewer. And also it talks about simple misdemeanors penalties for violation of those, of like say an lawful order of local boards of health. So this is what gives you a lot of your authority. I'm going to switch back a little bit to Iowa code. So on Iowa code, there's definitions, and we have to stick to those definitions because that is what we use in our administrative rules. So what the big one today that we're going to focus on is in 455B 1.171 is the definition of a private sewage disposal system. That's the main one. And this is I had to make sure that this was the correct definition because these things do change, but legislatively, this is what's in Iowa code. So a private system means a system which provides for the treatment or disposal of domestic sewage, and that's a key word, domestic sewage, from 4 or fewer dwelling units, or the equivalent of less than 16 individuals on a continuous basis. I put in there the 1,500 gallons per day. That is not in Iowa code. That's kind of, I would say, a guide that we use and our counties should be using when we're determining who is the appropriate permitting authority, such as the county or the DNR. So once again, this is what's in Iowa code. Under 0.172, that's where that authority and obligation to regulate it lies. And there it actually states that the DNR is going to adopt rules for private sewage disposal systems. Where it also defines is that local boards of health shall adopt those rules or adopt rules, and they can't be more, or they can't be less stringent. They have to be at least as stringent, and you have to enforce those. And basically, when we talk about county, we include cities, and there are used to be, and I think Dubuque was one of those. There were city health departments or city boards of health, and those, that isn't happening now, and probably won't in the future, because it obviously is cumbersome to be able to develop 2 different boards, and you as a county board of health are the one that is in the spotlight most of the time. Some of the other things that are within 172, septic tank cleaner law, and I'll talk a little bit. That's chapter 68 when we do administrative code. We also within there we have different funds. We talk about county inspections, enforcement, and within that chapter 68, where I mentioned it talks about where we adopt these fees. And like I said, in the Iowa code, it defines that we have to adopt those rules, and then the administrative code are the rules. And as my boss would say, the rules are the rules. A little more on septic tank cleaners. There's penalties. Once again, counties must enforce regulations. It should have penalties in ordinance. You also may administer a higher civil penalty fee than what's in there, but this also defines the fines by the county and state, or the ability to do so. Other thing that's a big portion of Iowa code that was passed by the legislature, 2009 to be specific, 2008 when it went into effect in 2009, is the time of transfer law. And that's where, if any time a structure is connected to a private sewage disposal system, and I defined that earlier, sells, transfers, basically is the correct term, then it is required to have an inspection done at the time of that sale. There are exclusions, there are exemptions. I'm not going to spend a lot of time today on that. That's kind of a class in itself. But this also is where there's always this question about what passes, what doesn't. Right now we don't have some of that specific language in our rules, and we are looking at defining that in a later version of chapter 69. And I'll talk a little bit more of that later, but we also define what's a certified inspector. And then, one big thing that's in there is that those inspection reports that they provide have to be provided to the county within a time frame, and that's an administrative rule. But the Iowa code defines that this is a requirement. I already mentioned these are the big hitters: 69, 68, 93. The Environmental Protection Commission, the EPC, is who is basically, when you talk about who's the DNR have for a boss, we have our administrator, department head. We also then have the Environmental Protection Commission, who is appointed by the governor. That basically is if you want to put it into a business comparison, is the chair, the chair of the board. I mean, it's the board of directors. All right, chapter 69. And like I said, if I if something I say, you need to ask a question, you can interrupt me or wait till the end a little bit. But what is Chapter 69? And that's, we want to make sure that a lot of people, I mean, if a county asks us that, then that usually is a sign that we need to do some education. And once again, Chapter 69 is where all of the, I want to say where all the body of what we do when it comes to onsite it's contained within. So that's where our construction standards are. This is where we prohibit types of discharges. This is where we in code require that either perk tests, soil analysis are done, and also require site evaluations or analysis to be done by counties. Within that chapter, we've got certain technologies, like it says in the slide. We're revising that in 2022. Starting, it's about it could be a 18-month, 12-month, 18-month process where we have to go through certain steps. And this is what I tell county personnel, including Bailey and Samantha, when I've talked to them, is you're never going to memorize this. I don't have it memorized. I always tell counties, if the day you feel like you've got it memorized and don't have to open it up anymore is probably the day you're not doing it correctly, because there's a lot of stuff in there.
Corey?
Yes.
This is Sandra Larson, and what comes before the board quite often are requests for variances. Does Chapter 69 give us any guidance on how we reject or grant variances?
Yeah, and I'm going to touch on that in a few minutes. So
And
if you kind of hold that
Corey,
thought.
we have about 5 minutes left.
Okay.
So.
All right. Well, let me move along here. So we won't talk about Chapter 68 as much, but in Chapter 68, that's where our pumper rules are for commercial licenses and counties that do inspections, which you guys do inspections for that program and receive funds. Let me talk about a little bit. I'm not going to talk about grandfathering. There is no such thing as grandfathering. And if anybody has a question of why that is, there is a Iowa Supreme Court decision on that. Here's where we talk about variances. So in Chapter 69, there is a blurb. It's the end of the chapter about a variance. The thing that you need to keep in mind in the bullet points here, a county can issue a variance or a waiver. And I will tell you that the future language is referring to it as a waiver, but you've got to demonstrate adequate or equal protection if you're going to allow that. That is the key. Or there's some kind of financial burden that's placed upon, as a result of not allowing that variance or waiver as a result. So that is the key there. You should develop some kind of process or form at the county. My recommendation is that you, and this is how I operated, and it seemed to work very well. People can apply for a variance, but it needs to come in front of the Board of Health. But as a Board of Health, this is what you should be looking for within that request. Is there a way to demonstrate adequate or equal protection, which is very hard to do sometimes. Okay. And in doubt, like I said, I'm always available for counties and Bailey to call when these things come up, and it has come up, right? Lots of resources. I do want to point out, I'm going to move through this, enforcement. And I heard you mention Board of Health or County Attorney's Office. That's a very good thing. You need to develop a relationship, develop a procedure. How do you go about doing enforcement in the county? That can be a long and arduous process. Obviously, lots of things involved with that. And then one of the other things I want to make sure, these are things that are in Chapter 16 that you shall be doing. And in Bailey and Samantha, I'll tell you, after our conversations, I've been getting on the stick to get this stuff going in the right direction and stay in the right direction. So doing site evaluations, that is required anywhere in code. And I'll end it on that a little bit, is anything where it says shall, that's expected. It's not arbitrary. If the Chapter 69 says shall, then that's what needs to be done by the county or enforced by the county. And so site analysis obviously is one. Final inspections, another one. all newly constructed systems shall be inspected by the administrative authority before a system is backfilled or a time of prescribed by administrative authority. And what we expect and what the legal interpretation of that is physical inspection. And then an as-built drawing must be done as part of that. It's better, in my opinion, to be done by the county, so it's accurate. And anyway, these are just things that, like I said, at a later time, maybe we can do some more education. That's great. Or if you want a copy of this PowerPoint, I can get that to you.
That would be great, Corey.
Yeah, and like I said, there's lots of things that are involved in an on-site program, and so we want every county to develop a model program. So that's kind of where I'll leave it. I mean, and I will say that, and I've told the Environmental Protection Committee this even before I started the job, that no county, anybody that deals with the on-site program, whether they're the contractors, the general public, engineers, whomever, is not going to be any better than your Board of Health or their personnel. So it's very key that you have qualified, trained individuals to do the work, and recognize that it's not an easy job, and they're going to wear a lot of hats. And I've told Bailey this, she probably will smile under the mask, but if there's somebody that's maybe unhappy about a decision, that probably meant that you unfortunately did your job correctly. And that's the part of the job that's tough, but that's what you have to keep in mind. So I'll leave it with that, and I appreciate the time you've given me today.
Corey, just another question. How do we, as a board, how do we get the information that there's adequate protection if we're going to grant a variance?
Well, and that's, it depends on the nature of the waiver or variance. If it's something to a well, like a private water well, or even a public water well, it's a lot more, I want to say there's a lot more nuts and bolts to that. There's a lot more factors that you need to consider. And so it could be anything from engineering controls that might be able to protect whatever you need to protect. If it's a well, if it's a setback, maybe easements, survey work, there's things that you're going to need to require when these variances come in order for you to do your job. And if in doubt, like I said, contact me and work with me to try and help you navigate that.
Okay, it kind of sounds like, depending on what the issue is, we should consult with some expert to get an opinion or something like that.
Yeah, or the staff needs to, need to put some eyeballs on it, obviously, know exactly what the waiver and variance is about, have a detailed request or application, and they put the onus onto the person that's wanting the variance, make them provide you that information, and then from there verify it, like you said, with an expert.
Okay, and then in chapter 69, it talks about certification of the people who do the point of transfer inspections. And is that your department that does that certifying? Yep. Okay.
Yep, that's our department.
And then the construction people do not have to be certified, is that correct?
Within chapter 69, we don't have a state requirement for a licensed contractor. We do expect the counties to make sure that the people doing the work know what they're doing. So how you as a county decide you want that to happen, whether you adopt a credential or develop a ordinance that defines what a qualified installer is, that's the expectation.
All right, thank you. Thank you so much for the presentation. Does anyone else have any questions? Any questions? I don't see any, Corey. So thank you for attending, and thank you, Eric, for
Thank you, guys.
being the backup man. Thank you.
Thank you.
The next item on the agenda, the Dubuque County monthly update for COVID-19, and the county health department is going to give an update.
Can everyone see my screen okay?
Yes.
Okay. Yeah, hi, it's Sam. I'm sorry that I'm not there in person. I haven't been feeling well the last few days, but I just wanted to thank Bailey for helping get everything for the in-person part of the meeting set up.
Yeah.
So this is just a quick COVID update, and then I'll just roll into general health department updates, and then any questions after that. So this slide I took from the CDC that came out last week, stating that the current state of the COVID-19 pandemic requires a refined approach to monitoring the virus. And that's because community transmission indicators that were developed in the fall of 2020 reflect the goal of limiting transmission with the anticipation of vaccine being available. And that situation has obviously changed since 2020. Neither of our community transmission indicators reflect medically significant disease or strain on a healthcare system. And community transmission levels are largely driven by case incidence, which does not differentiate mild and severe disease. So those are some sort of gaps that the CDC has recognized in following community transmission over the past few months as our situation has changed. So this is another slide I took from the CDC. Why focus our efforts on monitoring COVID-19 in communities as a whole? And it's the shift from eliminating COVID-19 transmission toward more relevant metrics, given our current levels of population immunity and the tools that we now have available after 2 years in this pandemic. Current high levels of immunity reduce the risk of severe outcomes. High rates of our vaccinations in Dubuque County and the US and world as a whole change these metrics. Availability of boosters and booster coverage also changes this as well. And if they're unvaccinated, the high rates of infection-induced protection are high. There's also a wide range of tools available for public health and clinical care settings to monitor this situation going forward. And there's more access to vaccine, therapeutics, and testing. Community measures should now focus more on minimizing the impacts of severe COVID illness on health and society as a whole. So with that, the CDC has come up with community levels. What we were presenting on before was community transmission levels, but this is just community levels, and it ranks counties on high, medium, and low. So as you can see from this map, we are at a level of low in Dubuque County, which is very exciting to hear. Community levels are based on 3 metrics. They're looking at new COVID-19 admissions per 100,000 in the last 7 days, the percent of staffed inpatient beds occupied with COVID-19 patients, and total new COVID-19 cases in the per 100,000 in the last 7 days. So when we're at a level of low community transmission, these are some of the recommendations from the CDC for community level prevention. They recommend that we distribute and administer vaccine to achieve high community vaccination coverage and ensure health equity in our vaccination outreach, maintain improved ventilation in indoor spaces, ensure access to testing, communicate with organizations and places that serve people who are immunocompromised or at high risk of severe disease to ensure they have access to adequate testing and vaccination resources, and ensure access and equity in vaccination, testing, treatment, and community outreach. And then they also provide recommendations for individual protections, which is stay up to date on COVID-19 vaccines and boosters, maintain improved ventilation in your own indoor spaces when possible, continue to follow the CDC recommendations for isolation and quarantine, which have not changed since you last saw our blue poster that we made and distributed throughout Dubuque County. And then if you're immunocompromised or at high risk for severe disease, make sure you have a plan for testing if and when you need it, and talk to your healthcare provider about possible treatment if you are to get COVID-19. So I believe we entered a low level on March 4th of 2022. And I just want to add a comment that these recommendations do not necessarily apply to healthcare settings at this time. So this is more Dubuque specific data. It's our positive case trend line over time from the start of pandemic in March of 2020 until today. As you can see, we are at a significant decline. And within the last 7 days, it's been reported on the Iowa Department of Public Health public dashboard that there's been 13 positive COVID cases in the county, which is significantly different than what we've seen in the past few weeks. And it's exciting. This is just some updated information on our hospital capacity, capability, and data. Similarly to our cases, our hospitalizations are staying down as well. Today, we're reporting 2 in Dubuque County. And unfortunately, we have had 1 death in the last 7 days, resulting in a total of 294 deaths in Dubuque County. But the incident management team continues to meet with our hospitals on a weekly basis to get this data and also continue to have transparent conversations about pandemic response and preparedness now at this point. This is just a breakdown of our positive cases by age in Dubuque County over the past month. So February 16th until, that should say March 16th, sorry about that. And it follows a similar trend that we had been seeing, that children and younger adults were making up the majority of our cases. But in the past month, older adults 60 to 64 are also up there in our case counts as well. This is a breakdown of our variance by month in Dubuque County. You can see that for February and March, the Iowa Department of Public Health reported that 100% of all of our positive COVID cases have been Omicron. And like I've said in the past, this just comes from an estimation as they sequence a certain number of COVID tests each month. So it's not an exact count, but it does give us an idea. And so far for the month of March, in the state of Iowa as a whole, they're reporting 99% of all positive cases are Omicron and 1% are Delta. So we're looking pretty similar to the state as a whole. With our COVID vaccinations, 70.33% of the county's 5 and older population has either completed their vaccination series or is currently in the process. 97.5% of the 65 and older population in Dubuque County is in the same situation. And 56.5% of our residents 12 and older have now received a booster, which is great as well. Just a reminder that if you have gotten your Moderna or Pfizer vaccination at least 5 months ago, you're eligible for a booster now. And if you've gotten J&J vaccine in the last 2 months, you're eligible for a booster now as well. Our full list of available vaccination clinics is on the county website as well as the city website. There are still ongoing walk-in clinics at the Visiting Nurse Association on Mondays from 3 to 6 and Fridays from 8 to 4:30. And I believe those will continue with anticipation that we get vaccination for those under the age of 5 in the coming months. And then we still have the Sleeves Up phone line to call to assist with scheduling vaccination appointments. And then we also have our VNA phone line, which is for just general COVID questions, which was originally targeted more specifically for quarantine and isolation questions. And on Thursday of last week, the VNA reported that since they started that hotline, 227 community members have called with their questions and been able to get assistance through that phone line. I just put up some of our testing resources in Dubuque County. Hardig Drug offers free self-administered PCR tests. And then we also have our free Test Iowa PCR kits at the Dubuque County Health Department, the Visiting Nurse Association, and then many other counties or many other places throughout the county. You can find those other locations at testiowa.com. 2 of the newest ones that we've added in the last 2 months to that list of administrators is the Dyersville Library and the Piasta Finley Pharmacy, which is great to get more testing resources out on that area of the county. For free in-person PCR testing, there's Hy-Vee Pharmacy and Proven Health Solutions. And then there's also the free federal at-home rapid test kits that you can order through covidtests.gov. And then lastly, there's free rapid testing through Epic Health and Wellness. And I'm sorry, that one is not free. That comes at a cost. But that's all I had for a COVID update. If anyone has questions on that, otherwise I can just touch on general department updates too.
I see no questions, Samantha. Thank you for that. And we're ready for the next update. Thank you. Unless you have something, Dr. Schultz.
No, I think, Samantha, it's wonderful that we are where we are, and that is through all your hard work and the VNA hard work and the medical community here. So it's really wonderful news, and I think we can probably enjoy our spring here. That's great. Thank you.
Yes, thank you.
Thank you. Yeah, I just have a few brief updates from the health department in general. I wanted to share that since the last time we met, Bailey and Laura have done about 20 in-home water tests for our Grants to County program. We're currently water testing through that program every Tuesday, but we've been talking about maybe increasing that to twice a week instead of once a week. As the weather gets warmer, we're anticipating more people to want to take advantage of that free testing program. And then I've been working with the Visiting Nurse Association and City Health on revamping a few things that we've been involved in that maybe were pushed aside or set to the side during the past 2 years. So that includes the Wellness Coalition that Sandra had talked about earlier. And then just some stuff with our septic and well permitting and ordinances with Bailey. So she'll talk about that more a little later, but we are planning for our first Dubuque County contractor meeting, which is really exciting. And then we're also looking at revamping a lot of our emergency preparedness. Like I said before in the presentation, now that things have quieted down a little bit with the pandemic, we've had more time to reflect on the past 2 years and start having conversations about what emergency preparedness can look like moving forward. So I'm working with the other incident management team members, Stacy Killian, Mary Rose Corgan, and Tom Berger on emergency preparedness related activities. And one of those includes emergency preparedness drill that we'll have in Dubuque County in May. And then also I will be attending a nationwide emergency preparedness conference in Atlanta the first week of April. So that's exciting too. The last update I had was that the VNA open house is March 30th from 4:30 to 6:30. Just a reminder for that. Feel free to stop by at any time and come and go as you please. But that's all, unless there's questions.
Thank you very much, Samantha. I don't see any questions tonight. So we'll move on to the next item, and that will be number 7D, VNA monthly update. Is there someone from VNA that would like to give an update?
Yes. Hi, good afternoon, everybody. My name is Brittany Hubanks. So I am the manager for the Visiting Nurse Association, and I am stepping in for Stacy Killian, who is on a well-deserved vacation this week with her family. So few updates for you. So I'll start with just our Board of Health grants that we subcontract with you all on. In terms of our Public Health Services grant, the new grant is scheduled to be released on Monday, the 21st. So Stacy and our team here will be meeting with Sam to take a look at any changes presented in the grant and then start planning services moving forward for those public health needs. Our BCC grant, which is our services that provide breast and cervical cancer screenings to our population, that is expected to be released next week as well on Tuesday, the 22nd. And we just submitted our semi-annual report in January to the state for that program. On the immunization front, we have seen an uptick in COVID vaccines during our regularly scheduled VNA childhood immunization clinics, which is a great thing. So any child that comes in that is over the age of is 5 or older is offered COVID while they're here. So we have seen more interest in that over the past month or so, which is always a positive thing. We are already fast at work on our 2022-2023 school age vaccine marketing and outreach. We get very, very busy at back to school time with kiddos that have to have required vaccines before going to school or to continue going to school. So we collaborate a lot with our school nurses throughout the entire county, already working on some information with them that they can send out with families at the end of the school year just to start getting it on the radar. And we already have our schedules open closer to that back to school late summertime to accommodate a higher volume, which we always see. So fast at work on that already. for the upcoming school year. Our tobacco grant, we are hard at work on that and have really made great strides. Our coordinator for that is Vicki Gassman. She has been doing wonderful, wonderful work. So working a lot with our childcare nurse consultants in the area and our childcare providers on resources, referrals, tobacco-free policies. We now have 2 youth ISTEP tobacco prevention programs, which are school-based programs in Dubuque that are active and have high memberships, and those are at Washington Middle School and Jefferson Middle School, which is awesome to see. We've added 5 businesses that have had adopted new tobacco-free and nicotine-free policies for their work sites. We are doing presentations to businesses and offering tobacco diversion classes quarterly to our local businesses. And then we have been participating in the Dubuque County Wellness Coalition, which you guys have already talked about tonight. So we do participate in that, which is the second Thursday of each month. And to date, we've done 38 presentations and had a total of 716 different participants at those different presentations and events. So great things going on with our tobacco program. That grant for the following fiscal year comes out next week as well on Wednesday. So busy week for grants next week, and we are ready to get those started. Just some agency updates on other grants or initiatives that we have going on. So our DEI, our diversity, equity, and inclusion work, have a few things going on around that internally. We are attending the DACU Resource Fair on April 26th. And I think that stands for Dubuque Area Congregations Unite, I believe. So that'll be exciting for that community event. This coming Saturday on March 19th, there is a Latinx resource fair at NICC Town Clock in downtown Dubuque. We will have a table at that event with all of our VNA information, including tobacco and all of our other programs. There is a flyer that I have available. If anyone is interested in that, I can get this to Sam and she can forward that out if you are interested in hopping down or looking more into that. And then we've also started working with a new Marshallese community group called the Monsoons in Solidarity. They are based out of Maquoketa. So their group is based out of Maquoketa, but with that population specifically, we see a lot of migration and a lot of movement. They tend to move a lot. So we just thought it would be good to network. So we have a broad network of resources. And we have trained 2 of their staff in safe sleep practices, and we're able to provide them some pack and plays that we have here to distribute to individuals in need that they come into contact with. In our maternal and child health arena, we're participating in the doula project, which is centered around African-American women in our community. We were given 5 initial slots by the Iowa Department of Public Health for the pilot project that we were selected for. We have 2 spots already filled, which is great because we have only been at this for about 2 months now, and that included getting subcontracts in place and all sorts of other things. So lots of exciting movement there. We have 75 total participants enrolled in our maternal health program. As of this month, we've completed 97 developmental screenings on children birth through 5. We've helped 19 individuals get on Medicaid through presumptive eligibility, which is kind of a fast track application for Medicaid for children and families. And then our oral health team has been hard at work with our sealant program in our school districts throughout the county. We have 1 school left to be completed, which is Lincoln. So they have been hard at work all year. And we have 2 preschools left that we will be visiting to do screenings and education for our preschool kiddos. And that program is funded through Dubuque County Early Childhood. Up and coming activity for the Dubuque VNA, our Junior Auxiliary Board, which is a fundraising group for VNA. They will be holding a golf outing on Monday, May 2nd. They usually have had a gala in the past years, every October, but with COVID, it's had to be canceled. So they kind of made a shift to an outdoor activity so that it's a little safer and we can get out and enjoy some vitamin D and some sunshine. So that is upcoming as well. And that is all I have for you this evening.
Thank you very much.
Thank
Any
you.
questions? No questions tonight, so thank you very much for your report.
Thanks so much. Have a great night.
Thank you.
I don't believe Jessica didn't come back, did she, to the meeting?
She did not. No, sorry about that.
Jessica was going to give a presentation, but she had a conflict with another meeting, so we will have to move that to another month. The next item is under action items, number 8, a variance request, Massey Station Road. Bailey?
Ken, do you wanna, this is Ken from Beasing and Associates. We got a packet in here. If you wanna.
Yeah, I think everyone's reviewed the packet, and this is your third appearance before us. Second, well, it's the third time this.
The homeowner was at the last.
This is the third time this has come before us.
I wasn't.
So do you have anything new to add other than what's in the packet? Because I think we've all gone over the packet.
Okay, assuming you've gone through the packet, and I appreciate that. The second item I would bring up is something I ran into just today that I wasn't aware of, is that the Iowa DNR had put out a residential on-site wastewater treatment and overview. It's about a 15-page document in regards to what we're talking about is on-site wastewater treatment. I've got the place to go find it on the internet here, and I'm going to pass that around to everybody so that you can have a chance to take a look at it at your convenience, because I think it would work well from a standpoint of how this thing actually, how these things actually get installed, and all the other aspects of those. So that would be probably good information, and it's based on the rules and regulations as they now exist, not the past ones.
All right, thank you very much.
So here goes.
Thank you.
And Bailey, I don't know if I've got enough there, but I've got an extra one if you want one of those two. I don't know if you've seen it.
Actually, we've made copies for our March 24th meeting.
Ah.
So we do have tons of them.
So you do have that on count.
Yep.
Good.
Are they in here?
No, do you guys want a copy? I can give you a copy.
Well,
I can give you, I have packets. here.
okay, all
Okay,
right,
yeah,
that'd be great.
You want them right now?
No, I
Okay.
get them after, yeah, thank you.
Okay, let's say with the assumption that, you know, everybody's has reviewed everything that we've got. I guess the thing I'd like to do a little bit on is to talk about wastewater treatment from a standpoint of what I define as the pieces and parts and some of the testing, just to get a better education of what happens through all that, if I may. In the olden days, 100 years ago, we had just what was called primary treatment. And that's essentially a sedimentation process. It's a tank, the solids settle, the scum goes to the surface, and the liquid flows through slowly. It was the standard of care back 100 years ago or 90 years ago. It essentially took domestic waste of 200 parts per million, which is what the normal is coming in from a BOD standpoint. BOD is biological oxygen demand. That is one of the testing parameters for determining wastewater. From about 200 parts per million, which was typical domestic waste, and took it down to about 75 to 100. So it didn't do that good of a job, but yet it was state of the art from that era. The septic tank in an on-site system essentially is that same primary treatment today. So that's the first step in any kind of an on-site system, being the septic tank, which is the primary treatment. The secondary treatment is the next step, and that gets the effluent from, let's say, 50 or what have you, down to a BOD of, let's say, by rule, it should be below 30. But I've seen sand filters that have done testing where they've been as low as 10 parts per million. And that from us is way beyond secondary treatment. So that's good to see. And I know the COCO filter systems that they publish their data on testing that the BOD gets down into that range also. So I think they're seeing that the two kinds of systems, being the cocoa filter and a sand filter, can both do a very adequate job, assuming they're properly designed, properly constructed, and they are properly operated.
I have
Beyond
a
that,
question. Do you
go
mind
ahead.
if I ask you a question?
Please do. If you got a question, jump in.
The company that makes the cocoa filter,
Yes, that's the name of the company that we've got defined there as Premier Tech.
right? Do they have any guidelines about how close their system should be to a well?
I have not seen anything from them
Thank you.
in that regard.
All right, thank you.
Okay, now, the third level of treatment, which came into play more recently, and when I say recently, I've seen it from probably the 1980s and on, is called tertiary. And that's when you get into something that's, when you've got various kinds of discharge, when you've got it going to a small stream that's got minnows in it that are, or let's say, trout streams, you need to protect that very much. So then you're into ammonia removal and nitrogen removal and that kind of stuff, and that's called tertiary treatment. And I'm not that familiar with it because it's technology that I haven't really applied. But in our instance, if we want to talk about what it is on-site, the primary, as I said, is a septic tank. The secondary is the cocoa filter or the sand filter. We can define the tertiary as, let's say, a small sand filter or a rock bed or some kind of a system after the sand filter or cocoa filter itself to get the liquid back into the ground or have a place for it to discharge.
I'm assuming that the absorption bed that you reference in your letter is
Yes.
what you're talking about right now.
Yes.
Okay.
And now in the many pages of information that I supplied, I guess one of the key things that that Justin and I talked about as to possible alternatives to try to get a situation where we didn't have a well problem was to see about the neighbor's well as an alternative, to drill another well, but it's going to can't be on our site because we don't have a big enough lot. But the monastery ladies, the people that give us the caramels and those kind of things, they own the adjoining property. And I worked with them in the past and was considering whether or not there might be value in asking them about drilling a well. And I know Justin and I have talked about that. Now, I looked at those as two alternatives. Then a third one that came up that was his idea was something that came in on the letter that I sent to you, which was a whole house filter system for the home. And I'm familiar with those because, and I should have brought it up because I'm familiar because I have one in my own house. And then it's got a UV thing that takes care of the bacteria and what have you. So if Bailey finds any E. coli or anything like that in there, that system will take care of it. The other thing it'll do is it'll take the filtration down to like 5 micron, which is way, way smaller than a sand particle.
Excuse me, if he was able to do a well on the other property, on the nun's property,
yes,
wouldn't that eliminate the need for any variances? Except for maybe the property.
Yeah, well, either one of those first two alternatives would eliminate the need for any variances. And
the well on the neighbors?
The adjoining well would do the same.
Okay. But he has not checked into that.
We have not gone to those folks at this point.
Okay.
I guess the thing that I've looked at this point is we've got 3 items. Those were 2, and the third one was the whole house filters. And
his well is no good anymore, really, right?
Well, I wouldn't say it's no good.
But it's
I would say
contaminated,
that his well is one that was drilled, some 40 or 50 years ago, because it was drilled when the house was first installed. I think it provides, there's no question it gets water out of it.
Yeah.
I think that would be a definition of whether it's any good or not. Now, the question of whether or not it is pure because of this sand filter situation that was built there within the last several years, which was not in accordance with any rules and regulations, not in accordance with any, nobody got any permits from the county or anything. They just built the, I was going to say it very strongly, but they just built the dang thing. And they didn't build it right.
Right, but the well is contaminated.
It is, but the other side of it is that once you flush it for a period of time, you can usually take, number one, minimize that, and the whole house filter will uncontaminate it also.
It seems like the last time this was before us, there was something said about shocking the well.
They did do that.
And it didn't work.
I don't know, because I don't think it's been, Justin can answer this better than I, and he's here, so via Zoom. Justin, there hasn't been any tests on that well since it was shocked. Is that correct?
I believe, yeah, that's correct. So with uncertainty on which way to move, we did have it shocked, but then, in what I've been talking to excavator, a well digger and the company we use to shock it. I mean, it's typically a temporary fix. Certainly the whole house filter with the UV function is going to be far superior in the end, and a long-lasting solution rather to the bacteria, the coliform. And yeah, there's, obviously to Corey Frank's point, the financial, yeah, of course, if you throw more and more money at any problem of most natures, they go away. So we have not explored the, buying land and digging a new well versus, the whole house filters. I think Ken can provide more information about that, and obviously has seen it at work in his house, but that is something that we have no reason to believe it would not provide clean drinking water and water for any other use in the house.
So at this point, we don't know if we've got a functional well.
Justin, this is Bailey.
Yep. Hello.
So, you haven't gotten another test done after I tested it? Cause I do remember you mentioning that your brother was gonna take it somewhere to get tested after it came back positive.
Yeah.
So you didn't get it tested after that?
Yeah.
May I interrupt? This is Matt Andrews. I'm Justin's brother, co-owner on the house.
Go ahead, Matt.
Bailey, maybe you remember me. I did submit an additional sample, which I paid for. I still think there was some residual coliform content. And the guy that shocked it was actually consulting with the guy that runs the treatment facility for the city of Dubuque. And they were going to reshock at a higher level. And maybe you can speak as to that sample. I think there was reduced coliform levels, but still some present. But it was their thinking that they are able to establish a zero coliform count by additional treatment or additional shocking. And then the key would be to prevent, coliform from infiltrating the water again, which, would either be, would be through the correct, septic install. So, I mean, if we could establish a zero count and then, we'd be able to keep coliform out, I think we'd have a usable well on site, granted a variance, so, I mean, that was obviously the hope without the expense of, moving well to, a site that we may or may not be able to do, so.
Thank you very much.
Thank you.
Is there a motion? Does anyone want to state a motion here?
Can I just add one thing? Before you try and think about a motion, something Corey brought up that I think was very important, that was a part of the evaluation, was an adequate or equal protection. As far as something you folks need to evaluate as far as something like this is concerned. And I guess my observation would be that that the whole house filter that we're talking about with the UV goes a long ways in that direction.
What would, I understand that for this particular house, but then what would stop every house from wanting to do that?
You mean to have a whole house filter?
And to come to us for a variance and say, oh, and by the way, we can put in a filter and we'll be fine.
Well,
That's what I would be
okay,
concerned
let me
about.
give you a little background if I may.
I think, I don't want to cut you off, but we have a lot to handle
Understand.
today. And I just want to see if anyone wants to state a motion here so that we can have further discussion. Does anyone want to make a motion concerning this request for a variance?
I have a question about a variance with the whole house filtration. Do we still need the variance? And if so, what would that be?
If you did the whole house filter, you would still need a variance because the well is still located too close to the,
So it's still
treatment
42 feet
systems,
from the
yes.
septic tank.
Which
I
is
would make a motion that we not approve the variance.
Is there a second to that motion?
I'll second the motion.
Is there any further discussion?
This is Adam. I would like to discuss a little bit about the potential, just the
Who is this?
potential with the,
Oh, hi, Adam.
oh, sorry. Can you hear me?
Yes, we can.
Okay, sorry. I just wanted to, the issue with too close to neighbors' property. I just wondered if they've been approached at all with that, because I know before they were, I don't know if complaining is the right word, but before they were not happy with some discharge coming out. So I was just curious as to if they've been approached or anything like that. I'm a fan of the whole house filtration idea. I think that's a good workaround considering the fact that it seems to me that the well is going to perpetually has the potential to be impacted over and over again with E. coli. So I think that is, to me, is a good economic workaround. But I was a little bit more concerned with the side of putting that variance next to a neighbor who was already not happy.
Yes, I mean, we have definitely talked to the neighbor. This is Matt Andrews speaking in, and, there was, the main concern was because of the, wastewater not being, was because of the incorrect design of the, septic system. So in a correct design, there would be no effluent that would, bother the neighbor. And she was, as long as we could have a, workaround that, did not give, effluent flowing into her yard, then I think she was more than happy to, be on board. So, and just to clarify, there was no E. coli, it was coliform, which is different. And
Oops, yes, thank you for the clarification. Yes, and I'm a fan of the cocoa just for the fact that it's a closed filtration system rather than open, which decreases some of the setbacks amount. So I like that part of the idea as well.
This is Justin. Can I make one comment to a question from the board?
I think we have a motion on our table, and was there a second?
Yeah.
There was a second.
There was a second. So we're really at the point of, for the board to have a discussion now. Does the board have any questions for the homeowner?
I'd like to hear what Justin has to say.
Okay, go ahead, Justin.
I think it's a valid concern that you brought up that if this variance was granted, was to stop other homeowners from doing so, or from coming before you for the same kind of variance. However, given our situation, I think it's quite unique. I don't know if the board's aware the type of purchase on this house was a foreclosure, and so we've sunk well over 6 figures into restoring the house, extensive renovations and remodel. And then also there was no time of transfer necessary. This was one of the exceptions or exemptions that Corey mentioned, but didn't go into in depth. And so there was no time of transfer inspection done on the property. And so we didn't know about this problem either. Obviously, if it was a traditional purchase, like most houses are going to be, you're not going to see houses coming before you of this nature with any quantity, that's for sure.
Justin, this is Bailey. So I do remember, I think it was Ken mentioning that you may use this as an Airbnb. Is that still your plan?
At this point, we're still, undecided. We may turn around and sell, but, anything that we do is obviously limited on having, some type of approval. And, we're looking for any workaround option that's going to get us there, no matter, what it takes. And, if the first two options of involving the neighbor or the monastery don't work, here we're stuck with a significant investment that has no means to gaining approved system.
And I don't, Corey, are you still on? He's gone, okay. Has anyone ever
No,
mentioned?
I'm here. I'm here.
So if that was like a summer home or an Airbnb, would a holding tank with an alarm work for that property? If it wasn't being used year round?
Holding tanks are, you're correct. They really should be considered on either seasonal properties like cabins, on a river, or some kind of infrequent use, because it sounds real great. You put an alarm on there, that's great. But, at the end of the day, it really does come down to how much water is being used. So something, that'd be an holding tank is an option, but it should be probably the last resort. And when you're looking at something that's more than just like 2 days a month, that type, that's the type of seasonal thing that really a holding tank probably works better on. Not saying you can't for this type of application, but that would be a financial burden upon those people. They're going to be pumping it out at a $300 to $400 or more bill.
That's exactly the number.
Quite a bit. So, it's hard to do a holding tank, but when you're looking at a rock and a hard place, those are options too.
If there are people there full time, you're pumping it out every 10 to 15 days. That's a lot of money on every 15 days.
I just didn't know if it was another option.
Corey, bother more or use more time. Corey, do you have any input or insight into this?
I think I've communicated to Bailey and to Samantha, our thoughts on variances, and particularly this property. Some of the, in the proposal with the cocoa filter as an option, obviously, the remark was made that, that is a closed system. That's, the setback on that is 50 feet and 50 feet on the tank. And it's closer to that setback, obviously, with the 42 and 42 feet. Where it becomes problematic is the discharge, that tertiary treatment that comes out of that cocoa filter. If you put it back into the ground, then the DNR and the rules require that it's treated like an open portion of the system again, because even though it's reduced the amount of bacteria that's coming out of it, it's still not water. So in any given day, that cocoa filter could have good results, but there could be an overload the next day and a lot of laundry done, and it may push out a lot of higher numbers. So that's why we can't just say it's water. So once again, then once you go back into that tertiary treatment, then you run into that same issue of, well, you're not 100 feet away. And I will say about wells, you have to keep in mind, and I'm not the well expert, Eric Day is. I would probably say, if you want to ask for guidance from the well side, it really should come from Eric Day with DNR. But that well doesn't just impact that property, or maybe even right there the adjacent property, but potentially, depending on what formation or where the water level or where the ground formation is, where the water is being produced from, that can impact a distance further away. So I will make, state that's why wells are highly protected, because you're not talking about just that property owner. You're also potentially talking about someone half mile down the road. So I don't know what the well, I can't remember from the conversations I had, if there's a well on the adjacent property where that well is at, so just keep that in mind. That'd be my input tonight.
Thank you, Corey. That was very helpful. We have a motion and a second on the floor, and the motion is to deny the variance request. I'd like to take a vote, all in favor of that motion. There's no further discussion, is that correct? I'm sorry.
I would just add that I
Sorry.
think we do need to check into the wells and seeing about tying into the neighbors or digging. And I know that's gonna cost money, but I think if you're gonna try and sell that property, there's absolutely no way it's gonna sell with the well situation the way it is.
Sell it or use it on an ongoing basis.
Right, yeah.
And in a way that we can feel, as a Board of Health, can feel good
And yeah, about the
them
safety.
using it in a healthy manner.
Mhm. So I think that would be the next step that I could see happening.
Okay, any further discussion, board members? Hearing none, then let's take the vote. All those in favor of denying this variance request, please say aye.
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 Aye. Those opposed to the motion say nay. The motion carries. I will say that this has been presented to the county attorney and we're asking for his opinion. But you have kind of heard the thoughts of the board tonight. So good luck. The next item on our agenda is under unfinished business. And we're going to give a executive director position update. Is Dawn Sherman on?
Yes, I'm here, Sandra.
Hi, Dawn. Hi,
Hello,
Dawn.
everyone.
Dawn, do you want to just give a short synopsis of the two groups that we spoke to?
Yeah, I'd be happy to.
Thank you.
I actually reached out to 3 different recruitment firms, 2 of them here in Iowa and 1 in Illinois. I did hear back from 2 of them, and so we set up a Zoom interview. They were about 45-minute interviews with each of the vendors. The first one was the Skywalk Group out of Cedar Rapids, Iowa. And then the other one was GovHR out of Northbrook, Illinois. So what we allowed them to do is just give us a presentation, present some of the materials that they use, walk us through their methodology of filling positions, conveying their experience specifically with health department employees and recruitments. And so we completed those in one day. And at the conclusion of that, the small group, there was a quick consensus to recommend GovHR for this recruitment process. I don't want to speak necessarily for the group, but I could say there was a lot of discussion that they have done recent health director recruitments, and we thought that was a bonus. Recruiting for a health director now versus 5 years ago is very different. And so having gone through that experience and being familiar with candidates that are out there currently seeking positions, we thought it was an added plus. The other thing is they have recently just wrapped up the recruitment for the city of Dubuque police chief, and they are currently working with the city of Dubuque on their fire chief recruitment. So again, we thought that was a great bonus for us that this organization is familiar with our community. We think that they will be able to communicate that the greatness of our community to our candidates and really be able to sell the organization in the community. So in front of you, what we were proposing, and I did receive the agreement yesterday and forward that on to Sandra. I'm not unsure if she had forwarded that on.
We did. We shared it with everyone, yes.
Okay, so that was the recommendation from the committee, and the total for that, those services were $23,500. And we did have in the budget that's going in the amendment on Monday, a budget of $30,000 for these services.
Okay. Thank you, Dawn. I'll just reiterate what Dawn has said, and that is we talked to the 2 groups, and the GovHR impressed all of us a lot. One thing, there were a few things that we liked about this group. Number one, their presentation was extremely professional. They have the experience in recruiting for health directors. They are a certified woman-owned company, and they have a good emphasis on diversity. So that will be taken into consideration on this search. They do a nationwide search, not just a circumference, a 200-mile circumference, which the other company was going to do. And this GovHR was very comfortable with doing panel interviews, whereas the other company, Skylar, wasn't as comfortable with that because I think they haven't worked with as much government recruitment. And then finally, GovHR has a guarantee. So if they'll keep working with us until we find an appropriate candidate who accepts the job. But if that candidate does not stay for a period of time, I think it's 3 months or longer, they'll come in and do the consultation again at no charge. We would have to pay some costs, but there would be no charge. So I just thought that was really good. We'll have more discussion after a motion is made, but is there a motion today?
I would love to make the motion to contract with GovHR for the position of the Dubuque County Health Director.
Thank you. Is there a second to that motion?
I'll second.
Thank you. Do any of the board members that weren't, so the people that were on this interview was Dawn Sherman, myself, Amy, and Jessica Smith. Are any of the board members that weren't on the call, do you have any questions for us tonight or any discussion?
No, I think I'm good.
Pardon me?
Nope, I appreciate you guys doing that.
Yep.
All right,
thank you.
thanks. All right, we're good.
And especially the fact that they are involved in our police department and fire department. They know our community.
Yes,
They've got a head start.
I think it's great. Yes, absolutely.
I think that's
Wonderful.
great.
I
So,
like the idea that they've given us a time frame.
yes, timeline.
And we're looking
Absolutely.
at July to August
Mhm.
to have this filled, which, you know, you go into something like this, it's usually so open-ended, you don't know when you're.
I know.
Although
I
they
know.
did caution that it's a tight job market, so it could take longer, but yes, the timeline, they are very
Yeah.
dedicated to not stringing anybody along, but getting the work and job done.
Right. One of the owners gave the presentation and she told us that this will be a difficult search because there have been so many retirements in the public health field. And the pool of eligible candidates, is limited. So I'm really glad that we'll have somebody professional helping us. Okay, so I think we're ready for a vote. All those in favor of hiring GovHR to do our recruitment for the health director, say aye.
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 Those opposed, say nay. Okay, the motion carries. Now, I believe that this will now go to the Board of Supervisors. We've also submitted it to the county attorney for his review and approval. So, Dawn, I think the next step is that we'll go to the Board of Supervisors, correct?
That is correct. It'll be on the agenda for Monday for approval. So we'll keep this process moving for you.
All right, thank you so much, Dawn, for all of your
Thank you,
help.
everyone.
Thank you.
Thank you, Don.
Thank you very much.
Thanks.
The next item on our agenda is the well and septic updates, permitting process and permitting fees. And just before Bailey gets started, this has also been submitted to the county attorney. And if we approve this tonight, I think we should approve it pending approval by the county attorney, but at least I think we can do our act on it tonight, so. You
Sandra,
wanna-
this is Samantha.
Hi,
If
Samantha.
I could just add, it's also been sent to the city health department and Corey Frank with the Iowa DNR for their review too, and we're waiting for comments from both of them as well.
Okay, thank you.
Okay, Sam, do you have the old permits?
I have just this one,
Do you have the
Bailey.
rules and regulations?
I do not have the rules and regulations on my computer, only this one.
Okay, so this is just a preliminary draft, but can you pull up the rules and regulations policy? You have that?
I have the newest version, yeah.
Yeah, okay. So this is just a rules and regulations policy for the homeowner and the contractor. Right now, we just have a rules and regulations. We would like for this to become like a policy. It goes through everything that we expect from the homeowner and the contractor and what they should expect from us. The different steps that they have to follow to pull an application and, the site evaluations and inspections and just goes over perk testing and stuff like that, which the other one, our old rules and regulations really doesn't have much of it.
And Bailey, I've reviewed this also, and it does track real closely with chapter 69 of the Iowa Code, administrative code that we're supposed to be following. So
Right. I did put a lot of chapter 69 in there just because that is those.
Well, that's
Yeah,
the
that's-
basis that we should
right.
be following.
Right.
So thank you,
Absolutely.
Bailey, for doing that.
Yes. So I mean, it's just pretty much I mean, if you want to just show them, if you guys have any questions, it's way more into depth than what we have right now.
Which is good.
I think it looks good. Is there a motion to adopt the on-site wastewater treatment and private sewage disposal system homeowner and contractor rules and regulations policy pending approval by our county attorney and the DNR?
I think Kevin raised his hand. I don't know if he wanted to say something.
Hi, Kevin.
Good afternoon, board. Thank you for giving me a second here. I took a look at the proposed application, and there are some contradictions between some of the tables and information in the application and what is outlined in our current Chapter 34 ordinance regarding these matters. And I just want to make sure that the attorney and your board is aware that if you adopt this permit, you may be adopting items that are not, they don't coincide with what our county ordinance says. So I didn't know if that needed to be said or brought to the attention of the board.
Well, I appreciate that, Kevin. The inconsistencies, I think we should correct. As far as the ordinance, our current ordinance, that is one of the things that we'll be contacting you and the county attorney about. We do need to adopt, I think, Chapter 69 for our county, but of course it hasn't been adopted yet, but that is the state law. And so
That's perfectly fine. I just wanted to make sure that everybody was aware.
okay. Are we, do you think, Kevin, would it be your opinion that we're prohibited from adopting this at this time because it doesn't match our county ordinance?
I don't believe so. Corey may be able to speak to this a little bit more, but I believe that the state ordinance would supersede a county ordinance. Can you confirm that, Corey?
I mean, right. Once again, like I said, a local ordinance can't be less stringent. At all times, the DNR in Chapter 69, and it's in Iowa Code to still maintain concurrent authority. So, I mean, I would suggest, and I do apologize to Samantha and Bailey. I'm about halfway done through some edits and some suggestions to that document. So, I would probably suggest that, I mean, you can either, like you said, approve it based upon edits, however you want to word the resolution, or you can say, take action by saying something to the effect of we authorize the department or the personnel to obtain edits and review and then come back for a final draft later. I mean, that's kind of up to you, but we still maintain concurrent authority. You're correct. Even if you don't have Chapter 69 adopted, it's adopted by rule, if that makes sense.
So I wonder, should we table it till the next meeting and that way the county attorney, is there a reason to rush it through or?
Only because Bailey will be meeting with the contractors, and so she needs to know how to advise them, I think.
Right, and I don't want to just push something through, you know, if we don't know exactly what we're,
Yeah, to me,
but
I didn't know that the DNR hadn't finished their edits, so to me, it doesn't seem like it's quite ready.
Yeah.
yeah.
So
I would
I was-
table, and that's okay, we can still show it as a draft at the meeting, get more feedback, because I did get feedback from 4 other contractors, but you know, more is better than less.
I would say that's probably a good idea, just because once again, you want to make sure that everybody has buy-in because everybody is a stakeholder in this process, right? So you get some good feedback from the contractors that you know in your meeting, and say this is the proposed draft, and and then once you get back to your board meeting, it should be pretty simple at that point. But that'd be my suggestion. You guys as a board can act however you would like to act.
Okay, thank you, Corey. If we table it, I think then we have to bring it back at our next meeting, correct? I wonder if it'll be ready by then.
I would, yeah.
Sandra, tabled items can be brought back at any point. It's not necessarily the exact next meeting. So once it's
Okay.
tabled, it's sort of in a parking lot where you can bring it back at any point.
Okay, who made the motion?
I made the motion to table.
The motion to accept it.
I don't think any.
There wasn't. There wasn't. Okay, so there's a motion to table the new policy for the contractors and for the septics.
This
Is
is
there a
Hendrik, I
second?
second it.
Thank you. Is there any further discussion? Hearing none, let's take a vote. All those in favor of the motion say aye.
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 Aye. All those opposed say nay. Okay, the motion passes. Thank you very much, everyone. The next item is new business, and this is a review of the Board of Health COVID-19 mitigation recommendations. And there were 2 suggestions included in your packet.
Sandra,
Yeah.
did we want to talk about the permitting fees or should we table that?
Oh,
as
I skipped right over that. The fun part, the money part.
Yeah.
So I'm sorry, we have to go back to the permitting fees. So these are the fees that we charge, the county charges when someone wants to put in a new septic.
Yep,
It costs $150.
currently. And
When they would do a septic reconstruction,
septic reconstruction, D-box replacement, holding tank, 50, we charge 50 for
and
that.
the well permit cost $150. So what Bailey and Samantha have done, they made a chart here. They contacted area counties to see what the other counties were charging for these permits. And you can see that we're not charging as much. And since the new rules are going to require Bailey to go out to the septic site 3 times for each new septic system that's put in our county, she needs to go out there 3 times. So it's a big job, and I think the fee could be made higher. Would anyone like to make a motion about the fees?
Is there a proposal?
Yeah, so we want to bring the septic permit and the well permit up an additional $100, so it'd be $250. But the wouldn't be an abandonment fee, and the septic reconstruction would stay 50.
Why is there no abandonment fee? Is that not an issue?
We've never charged for that. I don't.
Do you have to go out for that?
No.
No.
Well, I don't know.
You
We
may,
haven't-
yeah, you
We
may.
might have to. So that one I'm not sure on.
And what about the septic reconstruction? Would you have to go out just as many times?
I would still go out at least once to inspect it. Yeah.
Yeah, I really think that there should be fees for the abandonment fee. $50 for that, and then septic reconstruction, $100 for that. And then I don't think that would be an unfair assessment of fees, because it does require time and a person to handle that. So I think that there should be a fee for that.
Okay, is there a motion? No one's made a motion yet, right?
I have one more question. What do you base the $100 on? I mean, is there any comparable number in the industry, or would you just pick counties of the same size? I'm just trying to understand how you came up with that number.
Yep, so it was just the average. We took all the numbers, added them together, and then divided them by the number of counties that we got it from.
Okay, gotcha. No,
I also
that's-
think just for the size of our county compared to these others, that increasing by 100 would make the most sense. And it's also not a huge jump where we might get a ton of pushback from people out in the community.
Okay, so based on what other counties of our size on average would use, we are way below. That's what you're saying, which is as if we would compare ourselves to an industry. I think that's a fair assumption. Thank you for clarification.
And I mean, I should add, some contractors already know that, well, they don't know that we're going to be, bringing our prices up, but they know that it's coming. So.
Okay, so is there a motion?
I'll make a motion that we increase the septic and well permits to 250, the abandonment to 75, and the D-box or septic reconstruction to 100.
Okay, so it's looking at the chart, it's 250, 75, 100, and then 250 again, correct?
Yes.
Okay. Is there a second to that motion?
I'll make a second.
Thank you. Any further discussion? Hearing none, let's take a vote. All those in favor of the motion to increase the septic permitting fees, say aye.
Aye.
Those opposed, say nay. Hearing none, the motion passes. Thank you. Okay, the next item of business will be the review of the COVID-19 mitigation recommendations, and there were 2 recommendations in your packet, and they both follow the CDC guideline pretty closely. The first one that's presented is just applies to the low community level, which is where we're at right now. And the second recommendation includes what should also happen if we're at a medium or a high level. So those are the 2 differences. Those are the 2 proposals. If we want to make a change, if we want to change our recommendation. And Dr. Schultz, do you have any comment about making a change?
I think this is something that looks good to me. I think what we have to clarify again for the community in Dubuque County is that this does only apply to non-healthcare settings. Okay, so whatever we do here does not apply to a hospital or to a clinic, so that there's no clear understanding. I just wanted to highlight that, but otherwise I think I'm fine to go with the recommendations.
Okay, thank you.
Yeah, and I think there's a paragraph there that explains that.
Right. So the real question is, do you want to adopt one that applies only to the level we're at right now? Or adopt one that has all 3 levels that also states that if our level changes, the Board of Health will take a look at it again?
Yeah, I think that's what we should do, because my feeling is that if we would deal with another increase in level very rapidly, we might deal with something completely different. And I would not want to set the book for something we don't know yet too much. I think I would rather recommend them to reconvene and reassess.
Okay. And my thought was, because we can't reconvene always within 24 hours, we do need some lag time, that at least we would have something in place should we go to a high level community level or a medium level. So those are the two options. I think Dr. Schultz, you're making a motion to adopt the one that deals only with the low level. Is that correct?
Yeah, with the low level and then reassessment if
Okay.
the level goes too high. Yeah.
Is there a second to that motion?
I'll second that.
Any further discussion? Okay, the motion that's on the floor is to adopt the recommendation, I think it's recommendation number one, that deals only with what our community should do when we're at the low level of community, the community low level. So that's the motion. All those in favor say aye.
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 Aye. All those opposed say nay.
Nay.
One nay, but so the motion does pass. So we've adopted the recommendation that has the one level. Okay, the next item is the just to discuss the ARPA proposals from the visiting nurses and from Mercy One. Does anyone, and I know I apologize that you didn't have those ahead of time, but we just got those late this afternoon. So is there anyone here to present those? Is anyone here from VNA to mention what their program does? I don't think so. From what I could tell, I think VNA's proposal is to have a course of classes for some of their clients to help them become more independent, I think was the goal. And then as far as Mercy One, I couldn't really tell what they want. Do they want their whole budget? Or
Let's see, where were those? I saw
They were
them and now they're, well, they were in, I thought they were in here too, yeah.
I think they're
I
underneath
saw
this.
them, oh, underneath this one, okay, so I know I saw them, now I'm not seeing them. Oh, yeah.
So the VNA rep pay program, again, I think that was just, it's a request for like $24,000 to give some classes to some of their.
No, that's the
How much?
building
Oh, that's
part.
not it, okay. How much is it?
23,500.
23,500.
I don't know if that's it.
HR.
Oh,
I don't
Yeah,
know.
look at the
Would it be
VNA.
helpful? This is Ann McDonough. Would it be helpful if I gave it a little more focus?
76,560 is.
Okay.
Yes, please.
That $76,000 is over 2 years, so it's a commitment to a 2-year program. It is primarily, I think there's $47,000 generally that is for a salaried position. And that person would provide classes that are needed to 70 individuals that they currently are payees for. And then they would, with county funding, agree to admit an additional 5 individuals into this program. The outcomes that they're seeking relate to public health, in my opinion, better nutrition, better brain health, less use of substance abuse, just a lot of things that we're all after, but it is primarily classes for this group. The VNA obviously loses money on these services. They confirmed that to us, but it is a staff person. And I think one reason it's before you is you're also asking for staff people. So that's kind of, I think it's an evaluation there. Then I'll move quickly to Mercy One. That is a new Mobile One unit that they have been, that's my granddaughter moving through the room. Hello, Eleanor. Mercy One, Mobile One unit, and they asked us for a commitment of $100,000 each year for 3 years. The initial request was for $1 million. And basically they're asking us to be a significant partner for 3 years, but is $100,000 commitment for each of those 3 years. And that is what they use to do vaccinations. That's what they would use to do brain health screening in crisis time. And then it's outreach, but others in the community, Jess probably would know more about it as well. But how does that I mean, how much do we value, Samantha, I'd ask you from the incident management team. I mean, how much do we value what they're doing? They've provided a tremendous amount of vaccinations, including pulling into school parking lots to get kiddos after school. So that's what we're looking for is, you know, it's balancing, but we figure you are the people that are frontline with public health and understand what the needs are in the community. So any input you want to give is helpful.
Thank you. So for the VNA rep payee program, just some thoughts that I have. We are actually asking for more staff in our health department. And one of the areas that we want them to emphasize would be public education. And this might fall into that realm. Is the VNA program a 2-year program too, I wonder? Do you know, Ann?
It's going to be an ongoing program. They're asking us for the startup funding and then for 2 years continuation. I'm sorry, go ahead.
Yeah, it just, $76,000 seems kind of high, but if it's for 2 years, maybe not, I don't know. Anybody else have any thoughts about that?
Is this in addition to the ARPA from the county, or you're shifting it over to our budget? I guess I'm not sure where.
I think they just want our input of whether we think it's something that would be helpful to Dubuque County Health, I think.
Okay.
Yeah, and we did in September or in December when we reviewed the budget, the 5 ARPA requests, whether or not we wanted to propose them.
Well, I think they're both great for the county as a whole. What I really like about the Mercy One is it can go to the whole county, it's not just limited to Dubuque.
Yeah, it expands the radius. That's I agree with that, and particularly areas that are difficult to get from to or to get to.
Yeah,
so
right.
Yeah, I would agree.
I have to say that a goal to provide good health access, increasing access to health is that, you know, that's a priority for all of us. And I think that the Mercy Band would certainly help in that area. The VNA program is, the goals are excellent and what we should try to achieve.
But the only rebuttal I'd have to that, Marcia, is that in our reorganization, we're proposing to put that person within the health department.
Right, so would it be duplication?
Yeah. What is the difference between, I mean, I understood it a little different, Tom. I understood it in the way that, you know, this grant that the VNA proposes is for a very specific group of the vulnerable population, whereas the thing that we proposed was a more general education of the population in the county. That's how I understood it. So that's why I would not have a problem with that approach. I mean, sometimes there are certain groups from a healthcare perspective that you have to put a lot of effort in to keep them afloat. Others go way easier, and particularly when you deal with a group of impaired, vulnerable people in the county, they need that help and concentration most. It's a similar situation coming from hospital medicine, where you have case managers that look into the most complex and sick and complicated patients and what are their needs and what can we do. They don't focus on the normal urinary tract infection. They focus on the person who has 20 different health problems, no drive. And so sometimes it is worth making this investment for this particular vulnerable population. And I just wanted to offer that perspective too.
Thank you. Well, I think there seems to be a consensus that we highly adopt, I guess, the Mercy One proposal. Would that be true, everyone? Mercy One is pretty popular, okay?
I'm a little bit unclear because as I read the Mercy One proposal, we've got a request of $1 million. And I don't see anything in the documents that says this is now 100,000 a year.
For 3 years. Yeah.
Tom, that was during their oral presentation. So when they presented to us I don't know, a few weeks ago, that was Melissa Springer. That was her ultimate, in light of all of the requests we've been getting. Most presenters are modifying kind of what they're kind of zeroing in on what their nugget really is that they need to move forward. So that would be kind of their base request.
So the letter we have in the packet tonight, Ann, is dated the 25th of February. You're saying that since then, Melissa has made this a $100,000 a year. Okay.
During the oral presentation, everyone's kind of hedging what they're saying, right? So this is what they wish, but yeah.
Okay.
So we can't really take action on this tonight because it was an addition, but it sounds like there's pretty much consensus about Mercy One, maybe some questions about the money, and less enthusiasm for the VNA proposal, but still some really good interest in that. So I hope that's helpful, Supervisor.
I think so, because Supervisor Potoff is here with me as well. So he's heard your comments. So thank you.
Okay. All right. The next thing on our agenda would be if anyone from the board, board communication reports, if any of the board members have anything they'd like to communicate at this time or give any reports, this is a chance. Hearing none tonight. Our next meeting will be April 20th, 2022 at 4:30. That will be an in-person meeting here in the conference room, and there will be a Zoom option. But again, we will need to have a quorum present here in the room. Public comments. At this time, anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please raise your hand on Zoom, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Are there any public comments tonight? There are some on Zoom. Mr. Kenneker.
Thank you. I'll be brief. So my name is Wayne Kenneker. I live at 11645 Lizard Lane. So after reviewing the minutes from the last meeting, which was February 16th, and seeing the agenda for today's meeting, I noticed the change in time. And so that's where my question lies. In the minutes, it states that the intent was to increase participation or would help with more participation. My question, because of the fact that most other groups, as I mentioned before, the school board, emergency management, 911, ECIA, the Dubuque City Council, and to the best of my knowledge, all of the small town city council meetings, as well as at least one of the Board of Supervisors meetings, start after 5:30. So my question was, more participation, does that relate to the Board of Health members, or does it relate to the public and other folks?
Thank you for your question, Mr. Kenneker. But please be aware that we are limited in our ability to respond to such inquiries, and we are prohibited from deliberating or acting on the items. We do have a process now that we will respond to questions at our next meeting, and we will do that. So thank you for your question. Are there any other questions tonight or any other statements? I see Sam Wooden. Hi.
Oh, my name is Sam Wooden. Some of you may know me, some of you probably don't. I'm running for county attorney, so I just thought it'd be helpful for me just to kind of pop in and see what y'all are up to. I know y'all had a ton of work back when the COVID mask mandates started, and I reread some of the minutes from those experiences. It looked like kind of a terrifying time to be in your roles. I know some of you are new who didn't experience that, and some of you were here when that took place. So this has been a learning experience for me, and I appreciate the opportunity just to sit in. So thank you.
Thank you, Mr. Wooden. Any other questions or comments from Zoom? Anyone in the room like to make a comment tonight? No. All right, seeing none, then is there a motion to adjourn the meeting?
I will move to adjourn.
Is there a second?
I'll second.
Any discussion? Hearing none. All those in favor of adjourning, say aye.
Aye.
Those opposed, nay. Okay, the motion passes. We are adjourned. Thank you, everyone.
Thank you, everyone.
Thanks,
Good
guys.
night.
Thank you.
Bye.